My name is Brianna Freeman, and my atypical development topic is infant mental health disorders. Mental health disorders in infants such as depression, anxiety, and attention deficit hyperactivity disorder, or ADHD, can negatively impact their neurological, social, and physical development. The age range of infant mental health disorders is birth to 3 years old. Due to infants' inability to communicate their thoughts and feelings, their mental health often gets overlooked. The universal lack of diagnosis of infant mental health disorders is extremely concerning for a multitude of reasons. Infancy is a time of rapid brain and behavioral development, causing it to be a sensitive period during which a child is severely affected by its environment. An infant who experiences things such as traumatic events, parental mental illness, and neglect are more likely to experience mental disorders. Because infants grow and develop at such a rapid rate, early intervention is crucial to ensure that these children do not suffer lasting developmental consequences. Mental health disorders in infants directly affect their cognitive development and impairs their ability to regulate their emotions. The two major emotions of a newborn baby are contentment and distress. They are happy and relaxed when being fed and cared for, and they cry to let their caregivers know that they are in need of something. They start to feel noticeable anger at about 6 months old, and it is usually triggered by frustration. According to our textbook, in infancy, anger is a healthy response to frustration, unlike sadness. Feelings of fear or intense sadness trigger overproduction of the hormone cortisol and produces physiological stress and negatively affects the infant's brain. The child's caregiver plays a major role in their developing mind. Sad and angry infants who are not met with the care that they need are far more likely to become fearful toddlers and depressed children. According to the Infant Mental Health Journal, an infant's underdeveloped system places them in a unique state of dependence upon the care of attentive adults. Caregivers constitute the essence of the infant's world and are essential for the infant's capacity to regulate emotional and physiological states. During infancy, stresses on caregivers have more immediate consequences for the infant's own developing stress response system and overall development. Nature and nurture are the two biggest influences on an infant's growing mind. An infant's temperament is a part of their biological makeup and contribute to their development of a mental illness. Infants with difficult temperaments are at higher risk for later emotional problems, especially if their caregiver is depressed or anxious. Excessive fear and stress harm the hypothalamus, which links the nervous system to the endocrine system and helps regulate emotions. If an infant is often frightened or distressed, it causes the hypothalamus to grow at a slower than usual rate. Infant emotions begin in the brain and are affected by their early experiences. When infants experience a mental health disorder, it can have harmful, indirect consequences such as an inability to form a secure attachment to their caregiver. When a baby has depression or anxiety, they can be extremely hard to soothe, causing distress in both the child and caregiver. This distress can lead to neglect and a lack of synchrony between them, causing insecure or disorganized attachment. According to the Infant Mental Health Journal, infancy, more than any other developmental period, is a time of heightened vulnerability to disruptions in attachment relationships. These challenges can lead to disorders in infancy, place stress on parents, and can put further development of physical and mental health at severe risk. Mental disorders can also indirectly affect an infant's physical development. When an infant experiences frequent increased amounts of stress, it can disrupt their feeding habits, resulting in weight loss or gain. Mental illnesses like depression and anxiety can lead to physical ailments such as obesity and chronic fatigue later in life. Infant mental illness disorders present obvious red flags that parents and caregivers can observe in their babies. These include difficulties in emotional regulation, such as excessive crying, sleeping, or feeding problems, as well as aggressive behavior. Early identifications of these problems help to change developmental trajectories and improve developmental outcomes. The best way to observe an infant's mental health is by interacting with the child. If the child seems withdrawn, does not respond well to play, or if the child is easily unsettled and difficult to soothe, it is likely the infant is experiencing poor mental health. It is their caregiver's responsibility to document their child's developmental milestones because they spend the most time with the infant. For example, separation anxiety is normal at ages 1 and 2, but if separation anxiety remains intense after age 3, it is considered an emotional disorder. At this stage, a toddler who is developing normally will be securely attached to their caregiver. If they show signs of separation anxiety after age 3, they may be experiencing insecure resistant attachment, which can lead to dysfunctional relationships later in life. A common symptom of infant mental disorders is the failure to meet developmental milestones such as social smile, speaking words, and responsive nonverbal communication such as babbling, smiling, or cooing. Other indicators may include poor sleep patterns, excessive distress, and lack of weight gain or failure to thrive. When these symptoms are present, caregivers should seek professional help and have their child assessed. According to an article titled Infant Psychiatric Disorders, in terms of assessment and in accordance with the guidelines of the American Academy of Child and Adolescent Psychiatry, infant psychiatry have to consider the close relation between physical and mental health and the relationship between behaviors of the caregiver and the infant. Therefore, the assessment has to be multidisciplinary and relationship-based. A standard assessment in infancy includes a clinical interview, behavior observations, caregiver questionnaires, and a pediatric screening. All assessments should pay attention to motor, cognitive, language, and social-emotional development. Because infant development is embedded in the family context, socioeconomic factors, parents' mental health problems, including drug abuse, domestic violence, and trauma history, should be assessed. The treatment has to be oriented towards symptoms and development and has to address underlying medical conditions. The focus of treatment should be on parent-child interactions. Because most infant mental health disorders are caused by parental mental health problems, professionals can best support the infant via didactic developmental psychotherapy. DDP is a family-focused approach to therapy that focuses on relationships, attachment theory, and sensitive responsiveness. Didactic therapy was developed as an intervention for children who have experienced emotional trauma as a result of chronic early maltreatment within the caregiving relationship. The primary goal of DDP is to support these children in developing the ability to maintain attachment-based relationships with parents and caregivers. DDP holds the parent-child relationship in high regard and uses dyad as a platform for healing. During treatments, parents are taught specialized trauma-informed parenting approach, while children can learn emotional regulation and interpersonal relationship skills. DDP addresses both of these processes simultaneously in order to facilitate a trusting and secure relationship between parent and child. Infancy and toddlerhood is possibly the most vulnerable period of human life for negative and stressful experiences. The cause of infant mental health disorder is a combination of both nature and nurture. No single occurrence leads to this atypical development. Several factors contribute to a child's healthy development. Mental health disorders tend to piggyback off one another, and people who are diagnosed with one mental illness usually end up developing more later on. If an infant is showing signs of mental health disorders, early intervention is the best way to get the child back on track developmentally and keep them from undergoing more mental complications later in life.